Hi, I'm Raina Morgan with iHealthTube. Having the opportunity to visit with Robert Kowalski. He is the author of The Blood Pressure Cure. What are some of the drugs that are prescribed for high blood pressure? Could we talk about that?
Sure, absolutely. One of the things that I want to start out with is the concept that while it's true that there are natural alternatives to blood pressure drugs, if your doctor currently has you on a drug, don't immediately cease taking it.
Okay.
There can be repercussions to that. Instead, start into some of these approaches, lower your blood pressure even further, and your doctor very well may be able, if you're taking 2 drugs, to wean it down to 1, or to cut the dose in half, and gradually wean yourself off of drugs entirely. If the doctor has said that you are likely to need prescription drugs, ask him or her whether you can use some lifestyle modifications first. Almost certainly, any physician will go along with that and allow a trial of about 8 weeks. Come on back in a couple of months, we'll test you again and see whether we need to use the drug. So we first start with this, see how much improvement you can make, and then if necessary, you go on to a prescription drug. There are some individuals who really must be on one of the prescription antihypertensive agents. Those would be people with exceptionally high blood pressures. We normally talk about numbers of normal 120/80, hypertension being 140/90 as kind of a cutoff point.
All right.
Some people have blood pressures of 250/110. Yes, they are at real immediate risk of having a stroke, especially a stroke, and contributing mightily to heart attack.
Okay.
So those individuals definitely need to take some sort of prescription drug, no question about it. And as a medical journalist, I feel that has to be abundantly clear that there are people who will benefit from these approaches and those who will still have to take. Everyone will benefit in a way. Start with these kinds of things and incorporate them into your lifestyle. Certainly weight loss, increased physical activity, things like cigarette cessation, learning how to cope with stress, getting a better night's sleep. All of those come into play, certainly. And increasing the kinds of fruits and vegetables that can counterbalance sodium. That all comes into play with the prescription drugs and actually will help those people who do need those drugs to lower them. However, if you have a choice between the prescription drug and these natural approaches, I think in a couple of minutes I'll show you why you would choose the natural approaches. And I'm going to go directly to the chapter in the book that it's chapter 16, Understanding Prescription Drugs, and as I call them, the last resort to lowering blood pressure. Most doctors will begin with one of the most ancient of the blood pressure medications. It's time proven. It's especially necessary to start with this particular drug for African Americans because they tend to retain sodium that affects the kidney. And so you will most often see a beginning drug as what they call a diuretic. The diuretic is the one that makes you urinate more frequently.
All right.
As you do so, the body is getting rid of its sodium. Now, if you combine that happily with the fruits and vegetables to increase that even further, it's going to be a real benefit. But that's typically a starting drug. Now, what's the problem with that? I'll remember to the day I die, a couple of months before my dad passed away of his one and only heart attack. No warnings whatsoever. He knew he had the high blood pressure, but there were no symptoms whatsoever. But his doctor had measured his blood pressure. It was elevated, and he was placed on that diuretic drug. In those days, in the 60s, that was about the only drug available to him. We were playing golf about 2 months before he passed away, walking the course. and every hole he had to find a tree to go behind to take a pee. And he was kind of embarrassed, and he said, "Bob, I'm taking a diuretic because of the blood pressure. That's why." So this becomes a real nuisance for a lot of people. And even more of a nuisance, if you can call it that, the diuretics are frequently involved in a loss of sexual function. There is a great loss in libido with these agents, as is true for the next category of drugs called the beta blockers.
Well, let's stop here, and we'll come back and visit again. We got the first drug that will be given is the diuretic,
Right.
and then we will come back and talk about the beta blockers.
Right.
All right. Thank you very much, Bob.
My pleasure.